So we're here with Melissa Davies Yeager, and she is an old friend to us at Washington Township. She's been on WCTV. This is her third time, and she coordinated all of this. Thank you so much for the International Overdose Awareness Day, which will be August 31st. So Melissa is here to talk about the Recovery Center here in Newbridge and Recovery Day, which will be next week. So let's talk.
So thank you so much for having me. I am the outreach coordinator for recovery support services here at the Recovery Center at Bergen Newbridge Medical Center. We're located in Building 14, room F150, and we're in Paramus, New Jersey. So we are essentially a safe space for anybody in all aspects of recovery. And we're also a proud sponsor and partner with Alumni in Recovery and Recovery Day. So we'll be there. We'll have our people there. We'll have a table there, and we're very excited.
When is Recovery Day?
September 6th, but if it rains, it's going to be September 7th.
Okay, and it will be where? Located where?
Tallman Pool and Beach Club in Spark Hill, New York.
Okay, great. Yeah. I did get an email from Nancy LaBeouf, an alumni in recovery, and it seems to be that it's going to be a great day. There are going to be many vendors, a lot of people in recovery, a lot of different organizations that support recovery and short-term and long-term. So anybody can come to this recovery center? I'm a little confused. So maybe you could describe a little more what the recovery center here is all about.
So the Recovery Center is a New Jersey state-funded community peer recovery center, which serves as a hub for recovery support services for anybody in the community. And what that means is they don't have to have an affiliation with Bergen Newbridge Medical Center, but we are awesome because we happen to be located in a hospital. Every county in New Jersey has one. They have a recovery center. Some are in church basements. Some are in offices. Ours for Bergen County is located here in Bergen Newbridge Medical Center. Anybody's welcome. So they can come in if they're sober curious. They can come in if they identify with Alcoholics Anonymous, Narcotics Anonymous, Medication Assisted Recovery Anonymous. There's no judgment, and it's a non-clinical space. Because recovery is widely defined as a process of change through which the individuals, they improve their health and their wellness, and they live like a self-directed life to reach their full potential. So that could be different for everybody that walks through these doors. And what makes us different also is we are staffed with our recovery center by peers. So what makes that important is that the people who walk through our doors, we can, as staff, self-identify. So I can tell them, hey, I'm a woman in long-term recovery too. And I work a program of, and and that makes that client, that person feel seen and heard. And they're like, oh my gosh, you're not a clinician, like you're not a doctor. I can talk to you. You get it. I can also meet them at meetings. So they see a familiar face. And we want to make sure here that we're engaging with these people. Like initial engagement, saying hello, keeping in touch with them, introducing them to other people in recovery that are in the recovery center. And that's really important is community. When you're in recovery, community, it can make or break you.
Absolutely. And that's why here in Washington Township, we want everyone to know that all in recovery are very, very welcome, and that we have resources and education like Melissa and the other two wonderful people that we interviewed, and we are always here. So with that being said, you have anything else to say?
Yeah, I always like to say with our recovery center is there's no wrong door. Like in addition to all of the recovery support services that we offer at the Bergen County one here, our services are also aligned with Bergen Newbridge's passion in saying no wrong door. So that policy, it means that no individual is ever turned away, whether it's for support or assistance, no matter what point that they're at in their recovery journey, we are always here for them.
Okay.
You know, and the recovery center is open Monday through Friday from 8 a.m. to 8 p.m. And on Saturdays 8 a.m. to 4 p.m. And we do a lot of outreach. We do a lot of events. We collaborate with community partners like Alumni in Recovery.
Yes.
And we really try to do the best that we can and help with resources, with community, help with action planning, making sure that the people who walk through our doors, they have a recovery wellness plan, that they have questions, we have answers, you know. And at the end of the day, there's no judgment, there's no danger, we are safe, we are welcoming, and there's no wrong door.
And how do people get in touch with you, Melissa? How would they get in touch with you?
So with me or if anybody wants to get in touch with, whether it be me or anybody at the recovery center, they can always call our access line directly. The number is going to be at the bottom of the screen for anybody who's looking for it. The access line is open 24/7, and regardless of where you're at in your recovery, whether you're a loved one or you yourself are seeking treatment,
right.
You can call that line regardless of your insurance status or what, and there will always be somebody on the other line. And then if you're looking for the recovery center specifically, our phone number, which will also be at the bottom, is 201-967-4000. Extension is 24553.
Right. All these resources will be at the end and at the bottom of our screen, including Alumni in Recovery, the day of the Recovery Day and where it's going to be, as well as the time and date of the Black Poster Project, soon to be in Washington Township. Thank you guys so much. Thank you, Melissa. Thank you. Thank you. Okay, so now we're continuing in Melissa's office. And as I said before, Gary Cicchetti is here, and he is the Associate Peer Service Coordinator. And maybe you could speak a little bit about your position and how it intermingles with the International Overdose Awareness Day and what we need to know about fentanyl at this point.
Of course. As you said, I'm Gary Cicchetti. I'm the Associate Peer Services Coordinator here at Newbridge at the Recovery Center. I'm a recovering addict, over 20 years, almost 21 to be exact. So I've had experiences on both sides of the fence, using drugs and now in recovery as well. I ended up here at Newbridge 2 years ago. Mainly because, my whole life was changed due to getting clean. And when I was using drugs, it was a total disaster. It was a nightmare. It was living hell. And through my involvement in recovery, I see people continue to go through that same cycle. And, I wanted to do something about it. I wanted to help people, which we say in recovery, you got to give it away to keep it. So, I ended up right here. It was a blessing to get here at Newbridge. And I've loved it for the last 2 years. One of the, the disease is so cunning and baffling and all. It's in the mind. It's a terrible spiritual malady. But, we have a lot of help here at Newbridge. But one of the programs I want to talk about was called the Contingency Management Program, CM for short. What the program is, over many years, there's been numerous aids and medicines for anyone who was on opiates. They've had Suboxone, Subutex, now there's shots, the Brixadi shot, Vivitrol, Sublocade, I believe. So there's numerous stuff, methadone forever, but there's been numerous medicines and drugs to help people who have opioid addiction. Nothing for stimulants, crack, methamphetamine, cocaine, which, now they're putting fentanyl in these drugs as well, not just the opiates. And so the program CM came about. It's not medicine. It's an incentivized program. The client will take a survey. It takes about 20 minutes, 25 minutes to do the survey on paper. We load an app on their phone. The app, it's called Dynamic Care. The app, they will take a saliva test. They will video themselves taking the saliva test. We send it in. We give them a gift card and they get paid. So as they participate in this program, they get monetary rewards on a gift card.
So we were just talking about maybe you could expand a little more about fentanyl in particular, since we're talking about the International Overdose Awareness Day on August 31st. You were talking about, this particular program, which seems so awesome. I've never heard something like that before, where you take saliva and then you get paid to be part of the program. That seems amazing.
Yes.
But in particular, like, have you seen a increase in the fentanyl overdoses, and how are the fentanyl? How is that treated differently than any other addiction here at Newbridge?
Well, it's become an epidemic, as they say. The numbers are way up. When I was using drugs and when I got clean, we didn't even have fentanyl. But over the last, I can't even pinpoint, maybe 10 years. But each year it seems to get more, and then they have the carfentanil. There's less and less. But besides all the deaths from the fentanyl and how fast it could kill someone,
Right.
there's other additives. I've never seen so many other additives in the opiates, especially like heroin. What's the name of it?
So if somebody, excuse me, Medicines. Okay, so if somebody's thinking that they're buying pure opiates or heroin on the streets,
No.
it's not. It's a fallacy.
No,
yes?
no, it's a fallacy.
Yeah.
We've actually had here at Newbridge, I was speaking to the doctor about 2 weeks ago, and I was shocked that our doctors were having trouble detoxing patients because there's so many chemicals and stuff. The normal stuff they've been using for decades is not working because of the additives, and this Trank is the one, and the other thing, Melissa, you might know, the one that eats the skin up.
Xylazine.
Xylazine and xylazine. These things are killing people.
Xylazine.
It's crazy, causing infections, eating skin, and it's just amazing. It's not even like what heroin was years ago.
Right.
So there's so much. And then the pressed pills. There's plenty of that counterfeit pills, Xanax, Percocet. They're not real. It's
or
pressed.
even Adderall.
And that too.
Yeah.
And like I said, now they're saying even marijuana has been sprinkled with fentanyl. So it's very dangerous. It's been very bad. And
so if you had a word to the wise, because we're in Bergen County, and Washington Township is in an affluent part of Bergen County. So if you were to give any advice to the parents or anyone out there, or who has a sister, a brother, a family member, who you think might be struggling, what are the signs? What do they need to do? How could they get in touch with people here at Newbridge to get some help?
Well, we're easily available here at Newbridge. We're one of the biggest hospitals in the state. We're the biggest safety net. So we will take anyone, whether they have insurance or not. Every insurance in New Jersey is accepted here. As far as someone, if you think they have a problem, I would talk to them immediately, try. And then they lie sometimes as well. But don't let it go don't do something. Right. Because you might regret it.
Right.
And it's like 1 minute, it's over with. And you have to have that uncomfortable conversation sometimes, and stay on them.
Right. Also, camaraderie, right? Fellowship is a big part of the recovery program. Yeah. So what do you have to say about that, in terms of some people get treatment and then don't join any kind of fellowship and think that, hey, I'm okay, right? So I see a lot of clients that say, I don't need anything after treatment. What do you have to say about the response to that?
I would say that would be the biggest mistake anyone could make. In my experience, I've been to a treatment center, unfortunately, but fortunately, 19 times from 1987 to 2005. Okay. 19 times I went to treatment. They probably thought I'd never get clean. And you know what? I did participate in meetings, but somewhere I would fall off. But what I like to tell my clients, if you're by yourself, you're with the disease. If you're listening to your own thoughts, you're listening to the same person you got high with. The disease doesn't go away. It continues to stay. And but I found the 12-step for me fantastic. It's the best thing that ever happened to me. It saved my life. You know what I mean? And I'm around like-minded people, some fantastic people who've been there and can help. You don't have to do it alone. It's virtually impossible to do it alone.
Yeah.
The disease is such a liar. It tells you, it remembers the good times, because there were some good times. But for the end of the road, for most addicts, alcoholics, it was terrible. Right. Misery.
And what I'm hearing now in the rooms of AA, because it used to, for the purest view, years ago, AA was just supposed to be for alcoholics. but now people are experiencing people across addictions. They're welcome. Alcohol is an addiction too. So while years ago people would say to them, "Hey, you have your own NA meeting for that," but now they're welcomed with open arms. Correct?
For the most
For
part,
the most
you
part,
always
yes.
getting one or two,
Yeah.
But however, yeah, there's a lot of both, and and then the individual finds their home. Where they feel more comfortable. Someone who uses mainly drugs but drinks a little might find their home in AA, and that's fine.
Okay. And how does somebody find a meeting? How would they do that?
Numerous ways. They have a statewide meeting list online. There's a number to call. Usually you can Google NA or AA, and a host of whole other fellowships too, by the way. And a million different things will pop
recovery.
up. Yeah, smart recovery.
Right.
And then now it's so, with the information age, so the little thing you could scan the code and it'll tell you all the meetings in Bergen County or New Jersey or what have you.
Yeah.
So it's readily, and there's online too for people who are, might be shy or don't. I personally like in person, but during the pandemic, online meetings exploded. So there's still online meetings, and you can, if you're busy and you can't get out, you can do an online meeting on Zoom.
Okay, thank you so much. For what I'm hearing,
and we have them here at Newbridge.
What I'm hearing from getting the information about the Overdose Awareness Day is that we have to address this every single day. We might have one awareness day, but this is truly a battle with opioids, and it affects everyone from the professional to a blue collar worker. So that's what we're trying to do, is raise awareness right now. I can't thank you enough. Thank you so much.
Thank you. Disease has no vacations.
No, it doesn't.
Doesn't take vacation. Fentanyl, opiates,
So here,
methamphetamine. There's no vacation. It's always out there, and so we got to keep the fight going.
Thank you.
Thank you.
And thank you for what you do.
I appreciate it. Thank you.
Hey everyone, I'm Judy Beckmeyer. I'm Director of Health and Mental Health in Township of Washington. I'm also a licensed clinical alcohol and drug counselor. I work for Patterson Public Schools as a substance awareness coordinator. We're here today in Newbridge Hospital, which is right down the road, and we are interviewing Ellen Carmody. I was going to say Carmody, but she said no, it's Carmody, and I feel like she's a friend already. We spoke at length. Yesterday was a wonderful day. It is on the 31st, it's the International Overdose Awareness Day. But she was in New York City, and she's going to tell us a little bit about that, her role in alumni and recovery, and as a grieving parent, we're here to talk about how we as a community can react to those who are suffering from those who have experienced an overdose in their family, and what maybe you or parents would like to see us do as a preventative measure.
Okay. Yes, thank you for having me.
Yeah.
And I also work in Franklin Lakes as a pretty volunteer position as addiction and recovery advisor. So if the police are in need of somebody to help them connect them to services, I work with towns. And a lot of the time it's just a mother or father calling and saying, I'm worried about my child.
Yeah.
What should I do?
Right.
And so that's also very gratifying. Yesterday in New York City it was a fentanyl awareness prevention day. And we were in Times Square and also at St. Patrick's Cathedral. The DEA was there, and lots of dignitaries in government and Border Patrol and the like. And it was to bring awareness of this insidious epidemic that currently 2 years ago killed 107,000 Americans. This past year was 80,000. So we are going in the right direction, but we still have a way, way far to go. And just one loss is too many. Absolutely. Or in my case, one loss is the most excruciating thing that could happen, as I lost my son, Frankie Trotta, 1,033 days ago due to an accidental overdose in fentanyl poisoning. So every day I wake up and say, what can I do to help educate our neighbors and how to keep people safe? Because a lot of it is education. And our youth are born to experiment. That's what children do. They experiment. So we need to teach them the dangers of what's out there in the way of fentanyl and other horrible emerging drugs in this landscape.
I had a moment to see the live feed. As I was saying, it was raining. I was going to go, but I didn't. But maybe you could talk a little bit about what the Black Poster Project is, because we're trying to get it here in Washington Township.
Yes.
That's our plug, because we really need a lot of people supporting us. It is so moving. I did see it in Our Lady of Mercy Church. It's very moving. I was, very emotional that whole day to see the impact of not just our youth here in Bergen County, but throughout New Jersey and our tri-state area. And, maybe just talk a little bit about, the fentanyl, not just, heroin overdose. Like, how's it changed? What has happened? I mean, how careful do people need to be now in terms of, what Gary was saying before, in terms of, even pressed pills now have fentanyl in it.
Yes.
Yeah.
Well, to start with the Black Poster Project, of which Frank is a part, that organization is founded by Dee Gillen, a Bergen County resident, after her son Scott passed away. And I believe the organization is about 7 years of age. It started with about 40 posters of loved ones, parents, family members of loved ones who have lost someone. The Poster Project, Black Poster Project, is now up to over 950 posters.
Wow.
And they were all displayed in St. Patrick's Cathedral yesterday. And if you ever have a chance to see it, it is life-changing. It is the most emotional silent memorial that you could see, because you look around at all of these faces and say, that could be my kid, that could be my sister, that could be my mother. And that's what this memorial is for, because addiction is an equal opportunity destroyer. It doesn't care how much money you have. It doesn't care what kind of car you drive. It doesn't care what kind of education you have. I have a beautiful family. My Frankie is a triplet. I also have 3 stepkids. All of my kids are successful. I have PhDs. I have business owners. I have master's degree. And it doesn't matter. It strikes every kind of family in America. So regarding the current landscape, should anyone try an experimental drug? Absolutely not. It's like a 50-50 chance because of the fake pressed pills that our state lab tests. So we know this information is correct. 50% of those fake pills contain a potentially lethal dose of fentanyl. And what is a potentially lethal dose? As little as 2 to 4 grains of sand. That's 2 milligrams that will take your life instantly. And they are bought on Snapchat, on Instagram, by dealers, online, and so forth, by, as I said, children who like to experiment, because that's what they're born to do. So they think they're buying a Xanax or an Adderall or a Percocet, or someone comes up to them at a party and says, you look stressed out, you want to take a pill. And they have no idea. So when I speak in schools and community events, my message is, if you were not prescribed this by a physician and you did not pick it up at a pharmacy, do not take it, because one pill can kill.
Absolutely. And I heard the DEA speak at our New Jersey Prevention Network.
Yes.
And they were saying, dealers don't care. They don't care.
Yes.
They could be measuring marijuana on the scale. Wipe it off. There could be fentanyl underneath.
Yes.
They could be measuring cocaine. They don't care. They don't care. And it's like you said, the kids don't know this. And it's, it might be an experimental drug, as years ago, you would get away with it. But today it's potentially fatal. Yeah.
Yes. And I've had people ask me, if so many people are dying, why do the cartels do this? And it's purely for economic reasons. And I'll give you a quick explanation. It costs the cartels 11 cents to make a fake pressed pill. It's sold on the streets for $20 to $30 a pill. 1 kilogram of fentanyl is the equivalent of 2.2 pounds, which is like half a bag of sugar. 1 kilo of fentanyl will make 500,000 pressed pills. So multiply 500,000 times $20, and that's 10 million. And that's why they do it. They don't care.
They don't care.
So they kill a few. They have so many more others that they want to get addicted, and they want to sell their drugs to.
Ellen, you're so well spoken, and I just want people out there, especially in Bergen County, to know more about alumni recovery.
Yes.
And how it supports the Black Poster Project, and how it stimulates professionals like myself to really get the word out there. So what is it exactly is alumni recovery? Can you tell us a little?
Yes, also, Alumni in Recovery, also a Bergen County organization started by Nancy LeBeau 10 years ago. We just celebrated our 10-year anniversary. And it is made up of 2 different groups: young adults in extended recovery who tell their story of, their addiction story, and then their story of hope and recovery, alongside parents like me who have lost a child, or in some cases children, which is so heartbreaking. We speak in schools, we speak at community events. If we're invited to speak alongside the Black Poster Project, we also do that. And it's extremely powerful to have speakers alongside the Black Poster Project in the gym. And we have also begun speaking with retired members of the DEA, which bring, and I'm not sure.
Oh, and we're speaking here at Newbridge.
Okay,
and
what?
to the teens.
Oh, and Alumni in Recovery also speaks at Bergen Newbridge Medical Center to the teen program here.
To the teen program, yes. Which I'm looking forward to, Melissa, next week. So thank you for that. We're trying to get it in Washington Township. If we get enough funding, we can have speakers like you come along with the project. Right now, we got the approval for the project. We're just working on the logistics of where it's going to be and what day. I know the cost because Nancy and I have spoken about what it's going to be, but I just want the public really to know the message, like you were saying. Just one quick last question, because I think it's really important. I have a family member that died of an overdose as well. And it's very, very difficult, even your loved ones, to know what to say, what to do, how to support, you guys. Can you help us with that? Like, what do we need to do?
After someone has passed?
Correct.
No, I learned this in my church by a priest after my son Frank passed away. I was holding his picture. It was a memorial mass. And the priest said to me, the best thing that you can say to a grieving parent is tell me your child's name and tell me about him or her.
Yes.
Because our biggest fear is that our children will be forgotten.
Yeah.
And no one wants their child to be forgotten, because my child's life mattered.
Absolutely.
Every life matters. And that's why I fight this fight, because I know that my son is in heaven and he's proud of the work that I'm doing. And so ask a grieving parent what their child's name is and just ask them to tell them about them. And that's the greatest gift you can get.
This was so, I can't tell you how grateful I am that you could do this for
and
us.
Thank you for asking me.
Thank you so much. I know how difficult this is. We want to do as much as we can here in Bergen County and Washington Township to support people who have experienced what you have and educate. And you are a driving force. I am so happy I met you.
Thank you.
I can't wait to see how this comes out with the film.
Call me anytime.
I'm looking forward to do further work.
Okay. Thank you very much.
Thank you. Thank you. Thank you.